Welcome to this session presented by Mrs. Prudence Amito. We are faced with isolation of waste, and when we look at isolation, in most cases, we have patients who are going to be isolated from others, and also their waste should be isolated from the rest of the waste, because in isolation we are looking at the level of infection. Somebody is isolated, that means that person is highly infectious, and also whatever that is being used on that same person should be isolated. So let's look at medical waste isolation. So medical waste isolation refers to the process of separating and managing waste from patients undergoing isolations due to highly communicable diseases. For example, Ebola or TB or COVID, those highly communicable diseases. So this ensures the safe disposal of potential infectious materials and prevents spread of disease. So the reason as to why we shall isolate other waste from other waste is because some patients will be in isolation because of the condition they are undergoing. Maybe they have highly communicable diseases that they should not mix them with other groups of patients. So we have principles of isolations and barriers. One, isolation is separating individual with contagious disease to prevent the spread of infection. So as we are looking at isolation, it just means putting somebody who is highly infectious in a separate place. So we are separating those other individuals, and also we shall separate their waste. So barrier care involves using protective barriers such as gloves, masks, gowns, goggles to reduce the risk of transmission. So that is those are the two principles. So we have types of isolation. So the types of isolation comes with the mode of transmission of that infectious agent. One of which is contact isolation, we have droplet isolation, and then protective isolations. So all these are different types of isolations that you need to consider if somebody is having highly infectious agents. So we have what is called isolation precautions, which are implemented to prevent transmission of infectious agents among patients and healthcare providers. So they include contact precaution, we have still droplet precaution, we have airborne precaution, and then protective precaution. Sorry, it's their isolation, but it should be precaution. So let's look at contact precaution. What is it saying? Contact precautions are used for patients with a known or suspected infection that can be transmitted through direct contact, just from what it's saying, through direct contact. For example, Ebola, we have COVID-19, any other highly infectious condition that if you come into direct contact with that patient, you are most likely going to contract the disease. So they involve wearing gloves, gowns, following strict and hygiene practice. So when you are having patients in isolations and you have isolated them under contact isolations, you make sure that you also put on your personal protective equipment. So next we have droplet precautions. So droplet precautions are used for patients with infections spread through droplets generated by activities like coughing, sneezing, talking, laughing. You know, some people when they're talking, you see saliva is sprinkling on everybody. So if we have some kind of infection which is spread through coughing, sneezing, especially those other respiratory respiratory infections, we can isolate those other groups and we put them under droplet isolation. So the health workers who go to attend to those guys must make sure they have respiratory hygiene practice and wear a mask and other personal protective gears. Then we have airborne precaution. So airborne precautions are used for diseases that are transmitted through small airborne particles. So special respiratory protection such as N95 mask should be used. We have a negative pressure room might be necessary. So this one I can give an example of even in TB, sometimes just through the air that they are breathing in and out, you can, or the one they're coughing and while it's talking, you can easily contract. And then, so it is important that mask should be worn when you're handling such patients. We have protective precaution is implemented for patients with compromised immune systems, such as transplant recipients or individuals undergoing chemotherapy. So this protective isolation or precaution is basically for people who have lowered immunity or compromised immunity. People who are waiting to receive maybe organs and all those things also have reduced immunity, and we should make sure we isolate them under protective isolation. So its major aim is to protect the patient from acquiring infection and may involve strict adherence to hand hygiene and visitors. So for example, one place that I can also call it protective isolation is in ICU. You find that there we have visitors being restricted, we have a lot of protocols which are followed, and people should not be many there. So we have monitoring and auditing as a part of our waste management and isolation. So regular monitoring and auditing of waste management practice helps identify areas for improvements, ensuring compliances with regulations. So it also helps maintain accountability and adherence to proper procedures. So it's important that we always monitor and audit how waste have been managed within the hospital setting. Collaboration and communication. So effective collaboration and communication among health workers should be extended even to the people who are managing the waste. Because if we are not segregating the waste well, we are also not communicating, we are not collaborating with those guys who are going to later go and burn these things, because they themselves know that this waste have already been segregated. And then if you put highly contagious waste, for example, maybe placenta in the black container, you are putting the life of the person who is handling waste management at risk, because for them they will consider that you already segregated them. So let's collaborate and communicate among ourselves as health workers by making sure that the waste are put according to where they're supposed to be put. So clear guidelines and channels of communication should be established to make sure all this is put in place. Impact of inadequate waste management. So if we don't manage our waste very well, we'll find that there is going to be harm to public health, environment, even the local communities. So the harm will not only remain within the hospital, but it goes outside. So it can contribute to spread of infectious disease, pose risk to wildlife, water sources, and ecosystem, because all these waste that we are calling them infectious, if we don't handle them well, the animals can eat them, or it can be washed up to the water sources, and now we are spreading infection to the whole system. Environmental regulations and compliances. So health facilities must adhere to local, regional, and national regulations governing the safe handling and disposal of medical waste. So we have these guidelines being written down, others are put on the hospital walls, especially where you find those bins. So it is important that you follow the guidelines and the standard uh, regulations to make sure environment is safe. So compliances ensures that waste management practices are aligned with environmental protection standard. Training and education. So I think we have over talked about training and education. So when it comes to this part of training and education, we are looking at trainings which should be ongoing to make sure that if we have forgotten maybe about which waste is supposed to be in which bin or which container, then there is need that we remind ourselves through this training and education to make sure that we know how to segregate and handle waste and consider also the environment we are around. Infection prevention control committees should be put in place in each and every healthcare facility to establish these waste management practice or to oversee how waste has been managed or practice or waste management has been practiced within the hospital setting. So these committees are the ones who are going to deploy policies, they are going to conduct audits and ensure compliances with infection prevention control waste management guideline. So these are the same group of people after doing their auditing, and maybe if they have seen that people are not following the guidelines, they are the ones who might call up for trainings, and then they train people on how they can segregate wastes and also prevent spread of infection. So we can also go as far as giving public awareness and engagement. So specifically, this public awareness is for people who will be around the hospital setting. It's important that we make them to understand about proper waste disposal as it has impact on health and environment. So as you go for outreaches and those other community services, it's important we let the public know that whatever waste that we dispose in the environment has crucial effect on the environment. So public education campaigns can encourage responsible waste management practice at home even, and also in the healthcare settings. Then we have technology and innovations. So technological advancement can aid waste management, such as improved waste tracking system, automated segregation process, and advanced treatment methods. So by embracing these innovations, it can help to effectively save the environment from these other medical wastes. So we have also international guidelines and best practices which we are supposed to follow to make sure that we are following infection prevention control guidelines. So several international organizations such as WHO, World Health Assembly, they have provided us with guidelines and best practice for waste management in healthcare settings. So if you do not know how to manage your waste or segregate them, you can follow with WHO or you can follow with World Health Assembly. So the resources can serve as valuable reference for developing effective waste management strategies. So lastly, we are looking at cleaning and disinfection. Regular cleaning and disinfection of patients' area, surface, and equipment are essential to maintain clean and safe environment. We shall not only clean where we are going to sit, we shall clean even the area and surfaces of the uh, uh, where patients stay. So we should know the difference between cleaning and disinfecting. That I'll leave as an assignment for you. Use appropriate disinfectant and follow recommended protocols for effective disinfection. So additional precaution may be necessary for specific infection or conditions such as tuberculosis, those with multi-drug resistant TB or microorganism, then those other ones with airborne. So if you're cleaning, let's say the wards for people with TB or people with drug resistance or airborne disease, you need to make sure that there are specific precautions or additional precautions that you put in. Even I can say even in the labor suit itself, because that area always has spillage of blood, body fluids for the mother, and all those things. We are having liquor pouring there and all those things. So when you're cleaning the labor suit, you should not clean it the way you are cleaning where you sit to write. And also when you're cleaning, you start cleaning from less infectious site to highly infectious site. So don't contaminate the whole place with germs. Follow specific guidelines for infection prevention control uh, for these infections. So thank you so much for attending this session. We shall end our session here. And in summary, uh, even if you do not have enough time or you have very many clients at your desk, make sure before you start work, you disinfect and you clean. This is one thing you do first, what we call dam dusting. You clean where you work. You also make sure where the patients are, it's very, very clean. So thank you. See you in the next session.